10 strange signs that your body needs more iodine. 1. Eyebrow hair loss. Noticing thinning or loss of hair on the outer edges of your eyebrows? This is a subtle yet well-known sign of a sluggish thyroid, often caused by low iodine levels. Without enough iodine, your thyroid can't produce sufficient hormones, which disrupts the normal hair growth cycle. As a result, hair follicles shift into a shorter, less active phase, causing the hairs to fall out more easily. In some cases, iodine deficiency can also lead to overall thinning of the scalp hair. 2. Constant cold feet. Do your feet always feel cold, even when the room is warm? This could be an early warning sign of an iodine deficiency. Iodine is essential for producing thyroid hormones, which help regulate your body's temperature. When iodine levels are low, your thyroid slows down, leading to a sluggish metabolism and reduced heat production. As a result, you may feel colder than others, particularly in your extremities like your feet and hands. 3. Dry mouth. Experiencing frequent dry mouth? It could be a sign that your iodine levels are too low. Your salivary glands rely on iodine to produce adequate saliva. When iodine is lacking, these glands may underperform, leading to reduced saliva flow and a dry, uncomfortable mouth. This issue is especially common in people who practice intermittent or prolonged fasting, as fasting can deplete essential minerals like iodine and magnesium. To help restore balance, consider including more iodine-rich seafood in your meals during eating windows. 4. Unexplained weight gain. Gaining weight without a clear reason? Low iodine levels could be to blame. Iodine is essential for healthy thyroid function, which plays a key role in regulating your metabolism. When your thyroid slows down due to iodine deficiency, your body burns fewer calories, leading to gradual fat accumulation, even if your diet hasn't changed. Elevated stress and cortisol levels can also compound the issue, further slowing metabolism and promoting weight gain. 5. Breast tenderness and cysts. Did you know that your breast tissue relies on iodine every day to stay healthy? Without sufficient iodine, the tissue can become inflamed, leading to swelling, tenderness, or the formation of cysts. Women with low iodine levels are also more likely to develop ovarian cysts due to disrupted hormone balance. Interestingly, Japanese women, who consume about 25 times more iodine than the average American, largely through seaweed and seafood, have significantly lower rates of fibrocystic breast disease and breast cancer. This highlights how vital iodine is for maintaining hormonal and reproductive health. 6. Stomach ulcers. Your stomach lining relies on iodine to produce a thick layer of protective mucus that shields it from stomach acid and harmful bacteria. When iodine levels are low, this barrier becomes thin and weak, making it easier for bacteria like H. pylori to irritate or damage the stomach lining, leading to ulcers, gastritis, or chronic stomach discomfort. Overuse of painkillers like ibuprofen can worsen this issue. 7. Heavy periods. Heavier than normal menstrual cycles can be a hidden sign of iodine deficiency. Iodine plays a key role in helping your body balance hormones like estrogen and progesterone. When iodine levels are low, estrogen can become dominant, causing the uterine lining to thicken more than usual. This leads to heavier and often more painful periods, as the body works harder to shed the excess tissue. Supporting your iodine intake may help bring hormonal balance back in check and ease menstrual symptoms. 8. Lower neck lump. If you've noticed a painless lump or swelling at the base of your neck, it could be a goiter, a classic sign of iodine deficiency. When the thyroid doesn't receive enough iodine, it works harder to produce hormones, which can cause the gland to enlarge. This swelling may feel tight or uncomfortable, especially when swallowing or turning your head. Any persistent lump should be taken seriously. Be sure to consult your doctor promptly to rule out other thyroid conditions or health concerns. 9. Bleeding gums. Bleeding or inflamed gums could be more than just a dental hygiene issue, it might signal a lack of iodine. Iodine supports both your immune system and saliva production, which help control harmful bacteria in the mouth. When iodine is low, bacteria can thrive along the gum line, leading to inflammation, bleeding, and eventually gum disease. Boosting your intake of iodine and vitamin C can strengthen your gums and help fight off infection. A simple daily rinse with wheatgrass juice and water can also promote healing and reduce bacterial buildup naturally. 10. Fungal nails. Brittle, discolored, or thickened nails may be more than just a cosmetic concern, they could be a sign of low iodine levels. Iodine deficiency can lead to poor circulation to the nail bed, making it easier for fungi like yeasts and molds to take hold and cause infection. Applying povidone iodine topically is a well-known remedy, as iodine is a powerful antimicrobial that helps eliminate fungal pathogens. At the same time, increasing your dietary iodine intake helps to strengthen your immune system from the inside out, reducing the risk of future infections. Iodine and pregnancy. During pregnancy, a woman's need for iodine significantly increases. That's because iodine is essential for producing thyroid hormones, which play a vital role in the baby's brain development, growth, and overall health. If iodine levels are too low during pregnancy, it can raise the risk of serious complications such as miscarriage, developmental delays, ADHD, and learning difficulties later in life. For the mother, it can also increase the likelihood of thyroid-related issues. Ensuring adequate iodine intake, either through iodine-rich foods or safe, food-based supplements, is one of the most important steps a woman can take to support both her health and her baby's future well-being. Testing for iodine deficiency. If you suspect you're low in iodine, the first step is to get tested. A urinary iodine test is one of the most common and reliable ways to assess your recent iodine intake, since most of the iodine you consume is excreted through your urine. In addition, your doctor may recommend a blood test to check thyroid hormone levels, such as TSH, T3, and T4. Since iodine is essential for thyroid function, a deficiency often shows up as imbalances in these hormone levels. These simple tests can provide valuable insight and help guide the right nutritional or medical approach to restoring healthy iodine levels. Why am I low in iodine? Iodine is a critical nutrient used by at least 9 types of tissues in the body, including the thyroid, thymus, ovaries, prostate, and parts of the brain like the hippocampus. It also plays an important role in skin health and wound healing. The recommended daily intake for adults is at least 150 micrograms, with higher needs during pregnancy and breastfeeding to support fetal growth and hormone production. Despite its importance, iodine deficiency is surprisingly common. In Europe, for example, it's estimated that nearly 50% of the population has inadequate iodine levels. Several factors contribute to this. Depleted soils that lack iodine due to modern farming practices. Low intake of iodine-rich foods like seafood and dairy. Fluoride and chlorine in tap water and toothpaste, which compete with iodine absorption. Low selenium levels, which are needed for proper thyroid function. Goitrogenic foods such as soy, millet, and cassava that block iodine uptake. Protein deficiencies, which lower levels of tyrosine, an amino acid needed to produce thyroid hormones. When these factors combine, they can significantly reduce the body's ability to absorb and use iodine effectively. How to boost iodine naturally. If you're looking to restore healthy iodine levels without over-relying on synthetic supplements, here are some safe and effective strategies. 1. Include sea vegetables in your diet. Add iodine-rich options like seaweed flakes, dulse granules, or roasted nori sheets to salads, soups, and snacks. 2. Try Nutrigenesis iodine. This naturally fermented form of iodine is more bioavailable and easier for the body to absorb compared to synthetic versions. 3. Filter your tap water. Install a high-quality water filter that removes halogens like fluoride and chlorine, which can block iodine absorption. 4. Switch to fluoride-free toothpaste. For a natural toothpaste made with herbal ingredients instead of fluoride, which may interfere with iodine metabolism. 5. Choose sea salt over table salt. Sea salt contains trace minerals, including small amounts of naturally occurring iodine, without the synthetic additives and anti-caking agents found in iodized table salt. 6. Use electrolyte powders when fasting. During intermittent or prolonged fasting, replenish iodine, magnesium, and other key minerals with a clean, high-quality electrolyte powder. 7. Eat complete protein sources. Foods like fish, meat, shellfish, and grass-fed cheese provide not only iodine but also tyrosine, the amino acid your thyroid needs to produce hormones. For more helpful tips on health, wellness, and nutrition, don't forget to subscribe and turn on notifications so you never miss a video. Thank you so much for watching. I truly appreciate your time and support. Wishing you great health, lasting happiness, and abundant energy always.